Well, this is Dr. Rezi and the fourth session of prostatic cancer, pathology station in the MRCS Part B OSCE exam. The next question in this station, the prostate cancer station, will be as follows. The examiner will tell you a story. He will tell you that this patient diagnosed with cancer and he had a radical prostatectomy and his PSA is found to be 7. Okay, this is the end of the story. Fine. Before we continue here, you want to remember that the PSA should be less than 0.04, right? You all know that, right? So anyway, the story ended here. Radical prostatectomy and PSA is 7. So what is the question? The question will be, how can you judge the success of your radical prostatectomy? Okay, how can you judge that you did a successful radical prostatectomy? And your way to judge that, or to say that I did a good radical prostatectomy and I cleared all that cancer, is the fall of the level of PSA below detectable levels in 4 to 6 weeks. Okay, so the fall of PSA below detectable levels in 4 to 6 weeks, this is an indicator that you have done a good radical prostatectomy. Okay, so this question has finished. We will go to the next one now. Okay, he will ask you as follows. He will say that why prostate specific antigen is not reliable. And actually he is contradicting himself here, but this is the question. It will come like that. Okay, and you want to know what is your answer, because this is a very easy question and you will get the full mark in this question. Why PSA is not reliable for as investigation? And your answer will be like this. Okay, you want to know that the PSA is organ specific. What is the meaning of organ specific? It comes from the prostatic gland. Okay, and you want to know that PSA is not cancer specific. Okay, so finding high PSA, not very high, but higher than normal, doesn't mean that there is cancer. Why? I will tell you now. It doesn't mean that there is cancer, because in benign prostatic hyperplasia there is an increase in the PSA level. Okay, there is a severe increase in cancer in PSA, but there is an increase of PSA in benign prostatic hyperplasia. Okay, there is another condition in which the PSA will rise, and actually it is prostatitis. If there is an inflammation in the prostate, there will be high PSA. Okay. Well, number 3. If we have something called nodular hyperplasia or infarction, okay, hyperplasia, it is hyperplasia here, but this is nodular one, nodular hyperplasia, there will be rise in PSA. Number 4. Okay, if you made an instrumentation for the prostate, if you did a digital rectal examination, if you did a catheterization, this will lead to a rise in PSA. Okay, and again, it is not a severe rise like in cancer, but there is a rise there. That is why it is not reliable, but it's an indicator actually. Okay, and the last thing in which the PSA will rise usually is ejaculation. Okay, number 5. ejaculation. Okay. So these are 5 situations in which the PSA may rise. Okay. He may ask you this question directly. He may ask you that, do you know any other situation in which PSA can rise to high levels? And these: benign prostatic hyperplasia, prostatitis, nodular hyperplasia, instrumentation of the prostate, and ejaculation. Okay. Again, it is not as severe as in cancer, but it will be high. Okay. So that is why PSA is not reliable. It is organ specific, but not cancer specific.